My name is Teresa Boggs, and I'm a speech-language pathologist. I'm the clinical director of speech and language pathology services here at ETSU. And so what I was asked to do today is just to share with you a little bit about the field of communicative disorders. I'll talk to you a little bit about audiology, because that is within the communication disorders department, and then I'll share a bit more with you about speech-language pathology. I have been a speech-language pathologist for about 22, 23 years, and I kind of stumbled into the program. So it was quite by accident. I was an undergraduate, and I needed another course to get some credits, one of those kinds of experiences, and I went through the catalog, and for some reason I ran across a course that said Anatomy and Physiology of the Speech Mechanism. Now, I have no clue why that sounded interesting. At this point, it does not sound interesting whatsoever. But at that point, I thought, okay, well, that sounds interesting, and let me sign up for that class. And the class was exactly what it sounds like. It was on the anatomy and the physiology of the speech mechanism. But in the process of that, I learned that that was an essential amount of information to be able to become a speech-language pathologist. Speech-language pathologists work with a variety of individuals in a variety of settings. Personally, I have worked in the pediatric population most of the time. I work exclusively at this point with young children with autism spectrum disorder. Here at the Nave Center, we actually have a language program. You've probably seen kids in and out of the building when you're here. We have a pediatric clinic where children can come a couple of days a week, and they work on communication skills and they work on social skills. We also have a gym on the other side of the building, and we work on using language and communication when they're playing and when they're engaging in some movement activities. Speech-language pathologists work very closely with occupational therapists and also with physical therapists. So we have occupational therapy students from Milligan, and then we have physical therapy students from ETSU who come up and provide some consultative services for our children, and so we use the gym together and do a lot of interdisciplinary work. I think one of the things that I love just from a personal standpoint of speech-language pathology was the flexibility to work with a variety of age groups and a variety of places. When I graduated, or when I first started in the field, I wasn't sure if I wanted to work with infants who were in NICU and were working on feeding issues, or if I wanted to work with adults who had strokes in rehabilitation. So there was a wide range of choices for me. And so early on I did a little bit of both, and then over time I came to be more, specialized with children with autism. I think one of the best places to take you to show you about speech-language pathology and a little bit about audiology is to our professional organization website. Most professions have a national organization that kind of provides them licensure and kind of accountability. And so our organization is called ASHA. It's ASHA. And it's the American Speech Language Hearing Association. So I'm going to take you to that website and share some information with you more specific. .org. Okay. The information for, let's see if I can get rid of this. Which would not be how to do it. All right, anyone have a clue on how to get rid of this bar here so you can see? Oh, there we go. This is our national organization website. The website has information for the public, so if you were a parent or a caregiver of someone who had a communication disorder, you might go to this area here. I thought this might be where people would go who would be interested in the profession, but it really isn't. It will not give you any information about careers or where you might work in speech-language pathology. So I went to this area, and did I go to, just a minute. Surely they didn't change it since last night. Oh, there we go. So I went to that second, if you've seen the second drop-down bar, speech, language, and swallowing. And then what's an SLP? So let me just share with you some of this. A speech language pathologist, again, works with a variety of individuals who have speech issues, language issues, cognitive issues, difficulty understanding information, and then also swallowing disorders. So you may work with infants to adults, a wide range of disabilities and a wide range of strengths and areas of concern. They provide treatment, they provide assessment, and training for caregivers and parents. So speech-language pathologists work very closely with this population that they're serving. Some speech-language pathologists have some other roles as well. There are some in universities. There are speech-language pathologists who run private practices. They run their own business and see individuals. They may be involved in research. They may be providing kind of a supervisory role or a case management role for like a rehab facility. They may also be working with organizations that provide services to the community related to communication disorders. So it's a wide nature of responsibilities. As graduate students, when you apply to a graduate school, ASHA, the national organization, says to us, students need to be competent in, and they give us a wide range of things that you have to demonstrate competency in. So as a graduate student, you would experience interactions, interventions, and therapies, assessments with all of these populations to be competent. And then when you graduate it, you may choose an agency that serves all of those populations, or you may choose an area in which you specialize in. When we look at places you can work, as you can see, there's a lot of places that you'll find speech-language pathologists working, from public and private schools. Those of you, your experience in speech-language pathology may be from the school. There was a speech teacher or a speech therapist that was in the school. Hospitals, rehab centers, short-term care, long-term care, nursing homes, facilities, communities, colleges, universities. You can see the list goes on. Home health, and in research laboratories or centers for adults and children with disabilities. With a variety of places to work, there's also a variety of work schedules. And so as you begin to make decisions about what you want to do with the rest of your life kind of thing, sometimes you think about what kind of schedule you might need to have, or what kind of work environment you want to have. So there's a lot of flexibility in where you work and who you might work with. ASHA also goes on to provide some information about what you need to know about yourself personally for this kind of career. And I think they've done a pretty good job at describing what is the characteristics that a speech-language pathologist might need to have. They do really need to want to help people. It is one of those helping professions. Like many of the other allied health professions, you're going to be involved with people. And so there needs to be that desire to help people. I love an above average intellectual aptitude. I was like, oh, wow, I didn't realize that was a requirement. I felt kind of elite as I was reading that last night. But I think you have to be a hard worker, because there is a lot of information to know. Again, as you're in the field longer, I know a lot about autism right now, and I don't know as much about stroke patients or about head injury patients. But when I was in graduate school, I had to know a lot of information about a lot of difficulties and a lot of individuals. So it is a lot of knowledge gaining information. So you need to have that. You do need to be able to be in you have the perspective of an individual with a communication disorder. Because you're working with individuals who may or may not, and typically it's may not, be able to express themselves very well, you have to be pretty good at figuring out what people want and what they need. And sometimes you can have a conversation with someone and you just have a sense of where they're at and what they need. And that's really an important skill for speech language pathologists, because a lot of times we're always trying to figure out what someone is trying to communicate so we can help them communicate most effectively. We know that speech language pathologists need to be able to communicate both orally and in a written form. Orally in terms of having conversations with patients, so you need to be able to adjust your language to their level, but also you'll need to communicate to the physician if you're trying to get an order so that this patient can have a certain swallow study. You may need to then be able to communicate to a parent, to a teacher, so there's a lot of verbal discussions that go on. And then there is a lot of report writing. There's a lot of documenting progress and successes and intervention plans. And so you need to be able to be a pretty good written communicator as well. It goes on to talk about some of the things in high school that you might look at, which you're beyond that, and I know you're probably all very glad. Then it tells you a little bit about the graduate programs. The program at ETSU is certified by the American Speech Language and Hearing Association. It is credentialed, which means that it is our kind of governing body. And it tells us as an academic program how we need to train students and what you need to have so that you can become certified and get your professional license and so forth. So this website just goes on to talk to you about that, provide you specific information on how long it takes, what courses you need to take, and that kind of information. I have a little cheat sheet for you as well that I'm just going to leave at the back of the class. So if you are interested, you can just pick this up, and it tells you specific information about our department, about the speech language pathology program, about the clinical training. Graduate students in our program have to get about 300 hours of clinical service. So they're actually providing the intervention or the assessments for our individuals with communication disorders. And all of that work is supervised by a speech language pathologist, and they accumulate hours that goes toward them obtaining their license. It tells you a little bit about job opportunities, and then it gives you the admission requirements, what you need to do to get into the graduate program, and then what the curriculum is. So I'll leave these back there, and if you're interested, you can take a look at that. Of course, people are always interested in what you're going to make in your career, and they have a pretty good annual report summary that you can go and you can look at specific salaries. In speech language pathology, there's a wide range of income earning, a lot having to do with the different work sites and the different populations. Pediatric speech language pathologists often have a lower salary than those working with adults. So the average or the mean income is usually 50 to 60. And it can go up to 70, 75. Most of the students that graduate have a position before they graduate. They usually start looking in December, January. They usually have a position by March, April. Those who don't have a position just aren't really looking yet. So at this point, our graduate students are all getting jobs fairly quickly and are compensated well. The working conditions are good. I mean, there's certainly not any hazards that you're working in. Of course, if you're working in a medical situation, you're involved with a lot of different kinds of things, transporting patients or helping patients, but the work conditions are good. The profession is growing. We think that's happening for a couple of reasons. One, the need for speech-language pathologists has increased over the past 5 years quite a bit. Some of that is the growing number of veterans returning who need speech and language intervention. So we're seeing an increase in our head injury population. We're seeing an increase in our veterans. And so we have a lot of speech language pathologists in that area. For our pediatric speech language pathologists, we're seeing a growing need for speech language pathologists in the school system. We're seeing a larger number of children diagnosed with autism. And so communication disorders aren't going away. They remain fairly consistent. About 10% of the population at some point in their lifetime will have a communication disorder. So there has been a need for speech-language pathologists, and it looks like there will continue to be a need for speech-language pathologists, which is something else that you're looking at when you think about a career, that you have this career for as long as you choose to have this career. So our profession is growing, and the outlook and the need is increasing. So again, the website really provides you, what they call the fact sheet. These are kind of the facts about speech-language pathology. But if you go back to that first page, and if you look at the other information, you can see it gives you a sense of the places you might work, what speech-language pathologists are doing. It tells you what our scope of practice is. So if you look at the scope of practice, it will tell you all the different types of individuals you might work with and the needs that they might have. So if this is a field that you might be interested in, you want to learn more about, I'll encourage you to spend some time on the website going through that. And I would also encourage you to do some observations with a speech-language pathologist. Again, we have a clinic here, so we have children that are here Monday through Thursday. Most of the day, not all day, we do take breaks in the semester just like you guys do. But if you are interested in coming to observe, I'll give you a place where you can find my email address or our clinic email address. So if you are interested, I can tell you about the field and you can read about the field, but until you see it in action, I think that's when it becomes more real. We also have a clinic that is on campus. So our clinic is in Lamb Hall. It's on the 3rd floor, and we have children there Monday through Friday. We have some adults there. Our students get their adult clinical experience at the VA. That's a place that's really hard to do observations in. They're very rigid and strict with their policy on who can come to the VA. So even with our students in our graduate program, they cannot go work at the VA until they've been through like paperwork and clearance and background checks. So that's not a place that you could go. But some of the hospitals and long-term care facilities are very open to have people come and observe. If you think you might be interested in working as a speech-language pathologist and working in a hospital, most speech pathologists are really open to getting a phone call or getting an email and say, I'm a student and I may be interested in speech pathology. Could I come and spend a few hours with you to really get a sense of what they're doing? And then another option is we are at the Crumley House, and that is a inpatient and outpatient facility for adults who have had traumatic brain injury. And we do send a speech-language pathologist there. They are there 2 days a week. I believe it's Tuesday and Thursday. And they provide intervention for adults who have traumatic brain injury. So that would be another place that you could kind of observe. So I'd encourage you to check out the website and then spend some time doing some kind of observation or some kind of volunteer work with a speech-language pathologist to really learn more about the field. Our clinic does offer a variety of community service projects as well. And so I'll give you our website so that if you want to be involved, I was saying today at 3 o'clock we have Kids Swim, where we have children from our clinic who have a variety of special needs come to the CPA, and we work on helping them to use the language that they're learning somewhere besides a therapy room. So really helping them to kind of integrate better in the community. And sometimes just being around the population that you might want to work with one day either really confirms, yes, this is what I want to do, or maybe not. Maybe this isn't for me. The program here at ETSU is very competitive. We just finished going through our applicants. We had over 200 applicants apply for grad school, and we can only take 25. Now, saying that, you want to, and I don't know where you guys are, if you're freshman, sophomore, I should have asked that before I got started, but strong GPAs. If this is a field you want to go into, work hard in your undergraduate classes, make good grades, do well on the GRE, take it again if you need to. If you didn't do so well that freshman or sophomore year, because you were kind of had that freshman party-itis mode, that's okay. It's never too late to change that. Our program actually looks at the total GPA, and then it looks at the GPA in the last 2 years, and then it looks at the GPA within particular communicative disorder classes. But it is a competitive program, and it is meant for someone who really knows that's what they want to do. Do your homework before you apply, get involved with someone that's providing the service, and that increases your chances of getting into a program here or at another university. Let me leave it at this point and just ask if anyone has a specific question about speech-language pathologist. Yes?
I don't know. When did the university first start off in your specialty?
The field evolved from a special education has been around for a long time, and there was a group of individuals back in the 50s who said, we have some kids in our school that they need more than a teacher. They're having these other communication problems. So it started out that there was a group of people that were interested in helping children with communication disorders. And so the field is relatively new, although that sounds really old. Our program was established in the 60s. I think in about 67 was when ETSU had a bachelor's degree in speech-language pathology. At this point, you're not able to practice with a bachelor's degree in speech pathology, so our program is a master's only degree. So there are some courses that you have to have in the undergraduate program that are communication related. You get a minor in communication disorders, and that's on this little kind of bluish sheet. So it was about in the 60s. I think it's another reason it's a fairly new field, and it's continuing to grow, because 60s isn't really that old. So, other questions? Anyone know someone that's a speech-language pathologist? Already familiar? Okay, with the field? Okay. Yes?
More for my information as well. Does the state Tennessee offer other programs other than what we have?
In Tennessee, the UT has a speech, language, and hearing program, as does Memphis. I don't know about MTSU. I know they have an undergrad. I know they have a bachelor's degree at MTSU, and I don't know if they offer a master's. We get a lot of applicants from MTSU, but there are several programs in the state, and of course many outside of the state as well. Once you go through your program, you become certified through ASHA. After you graduate, you complete a residency program. It's a 9-month residency program. It's a paid residency, which is important. So after you put money in for your bachelor's degree and then a master's degree, you're ready for a paycheck. So you do get a paycheck during that 9 months. They call it the clinical fellowship year, although it's really a clinical fellowship 9 months. And then you become licensed through whatever state you're working in. So I hold like a Tennessee license and then a certification through ASHA. So, but you got kind of plenty of time to think about those details. Okay. All right, quick sheet on audiology. I'm going to leave this here as well. There was a time, my bachelor's degree is actually in speech language pathology and audiology. So it was kind of a mixed degree. Then when you went on to your master's, you either became a speech language pathologist or an audiologist. An audiologist is concerned about hearing and communication purposes related to hearing. Now you have to have an AUD or a PhD to practice as an audiologist. And so our program offers an AUD, which is a clinical audiology degree. It's a degree saying that you want to be kind of a practicing audiologist. Audiologists provide assessment for many kinds of hearing issues, as well as balance issues, anything related to the inner ear kinds of problems. And then they also provide intervention for children who've had cochlear implants. So you have some audiologists who specialize in working with the hearing impaired population. We're seeing a growing number of individuals getting cochlear implants, so we're seeing more clinical audiologists doing rehab as well. The places that they work is very similar to speech language pathology. They're in hospitals, long-term care facilities, schools, at the VA. The salary is a little bit better because it is a doctoral degree, so it ranges a little bit on the higher scale. The same kinds of skills are needed because you are working with individuals, and you're often working with individuals who are not communicating with you very effectively, maybe because they don't hear you, and so you need to be patient as you try to help them, equip them with the best kind of devices that they may have. And then audiologists have a little more, I think, time in terms of some of the technical technology aspects, because they're working with digital hearing aids. They're doing a lot of computerized assessments and dealing with a lot of equipment and technology. And so if you're interested in kind of a profession in which you are helping individuals to be better communicators, to hear what's going on in the world better, but you also like that technical technology, hands-on, manipulate the equipment kind of piece, then audiology field might be a good suit for you. I will leave, again, both of these here for you. I encourage you to go to this website. And then if you go to the ETSU webpage and you go to academics, we are, of course, in the College of Clinical and Rehabilitative Health Sciences. You can find that pretty quickly. And then when you go to departments and programs, you'll see audiology and speech language pathology. Oh, well, we're sorry, huh? Oh, well, shucks, it says. I haven't seen this one. Interesting. Well, Anyway, it should be there somewhere. They must be down. But you'll also see under clinics, you'll see our speech and hearing clinic. So if you would like to do any kind of observation, spend the day with us, hang out, and find out more about what we're doing, just click there. And again, my name is Teresa Boggs. You'll see my email address on there and phone numbers, and I would be more than happy to have you come and shadow one day or talk to you on a more individual basis. Okay? All right. Have a good rest of the day.